Welcome to Indiana News Desk. I'm Joe Wren. Insulin is not a new drug, but even though it's been around for nearly a century, its price continues to climb. People who suffer from type 1 diabetes have to take it to regulate their blood sugar. But as Sarah Whitmire reports, a recent study shows as many as a quarter of people who need insulin ration it because it's too expensive.
Sarah Skipper says she's doing okay now.
So I've really just received a lot of donations recently, and I mean, that's really been helping out a lot.
But it's a new feeling, despite having insurance and a full-time job. Just as recently as a couple months ago, Skipper was putting herself in risky situations, trying to ration her insulin or borrow from her sister, who's also a type 1 diabetic.
When I'm using her prescription, I mean, it's taken away from her. So if she runs short, then it's just like, you know, it's like a double-edged sword, kind of, which we ran into some trouble last summer. We were sharing a vial of insulin, and I had took my portion, and somehow our wires got crossed, and she took half of hers, thinking that I hadn't already taken mine, and so the next day she ended up like sick and was in the hospital for 4 days.
Skipper recently decided to talk publicly about the challenges she faces.
This isn't something that, of course, we want to do. It's a life or death situation.
And she was met with an outpouring of support and insulin donations. Her story is similar to those of a lot of other people who struggle to afford the insulin they need.
I certainly have patients who have either reduced the dose or skipped it completely.
The problem is, if they reduce their insulin, their blood sugar will rise higher than it should.
You know, if it was just a number and it had no consequence, diabetes wouldn't get nearly as much attention as it does.
Higher numbers over a period of time can cause serious medical problems, including blindness, kidney failure, an increased risk of heart disease and stroke, and even death. Dr. Hancock says at least 3 or 4 times a day, a patient mentions some sort of struggle in paying for their insulin. According to the American Diabetes Association, the price of insulin nearly tripled from 2002 to 2013.
There's 3 companies who have total control over this market, and they have a customer base which absolutely has to have the product to survive. So they can raise it to whatever price they want to, and to be honest, they have raised it to this enormously high price. And people still pay it because they must pay it to survive.
Those companies are Sanofi, Novo Nordisk, and Indianapolis-based Eli Lilly. Eli Lilly did not respond to multiple requests for comment, but the drug makers have long said their prices reflect the time and the effort it takes to develop products and the risks the companies take on.
There's been some really important recent research that analyzes the cost of manufacturing insulin, and the estimate is it costs about $5 to manufacture the same vial of insulin that has a list price of as much as $300 or more.
Drug company executives were called before Congress last week to explain their prices.
As a physician, I do recognize that medicines are only helpful if patients and healthcare systems can afford them.
Eli Lilly wasn't there, but in response to growing pressure, the company announced this week it would begin selling a cheaper version of its top-selling insulin, Humalog. In a statement, Lilly's chairman and CEO David Ricks wrote the cheaper insulin will be available to address gaps in the current pricing system. For people with diabetes, he wrote, a lower-priced insulin can serve as a bridge that addresses gaps in the system until a more sustainable model is achieved. But while critics say the half-price generic is good, they think Lilly and other drug makers could still do a lot more to lower prices while continuing to make a profit. Dr. Hancock says there's plenty of blame to go around.
Between the patient and their drug manufacturer, there's me, there's the doctor, there's the pharmacy, there's the insurance company, there's the pharmacy benefit manager, there's the wholesaler, and then there's the drug. Right? So as that drug moves through the chain, every time it changes hands, that's an opportunity for a fumble.
There's no superfood or anything that's going to get rid of type 1 diabetes. You have to have insulin or you will die. And it just doesn't make sense that it's this hard to get it. I mean, if we don't have it, we die.
For Indiana News Desk, I'm Sarah Whitmire.
With us is George Huntley, a longtime diabetes advocate and a former national chair for the American Diabetes Association and an Indianapolis resident with type 1 diabetes. George, thank you so much for coming on.
Thank you for having me.
So let's just start with the structure of how these drugs are priced.
They're very convoluted, but you have a list price that the uninsured or underinsured pays. Then there's a rebate and discount off of that list price that gets to the net price that the manufacturer winds up keeping. In the case of insulin, list price is like $300 a vial. Net price is around $68. So there's over 70% of rebate and discount that's going through to the middleman, the pharmacy benefit manager, and they're purchasing market share in the process.
So is that where people like yourself and advocates are working to try and get these prices down?
That's exactly right. We're trying to get rid of that swath that the middleman is taking out, because patients are being impacted at list price. So I'd say they've played the game of raising the rebates, which they're raising the list price to go along with it. So the manufacturer's still getting what they're getting, and they're just raising the list price. And until patients started to pay it through high deductible health plans, it wasn't really a problem, but now it's a very serious problem.
So why does this have to be so complicated?
Oh, that's a good question. Yeah.
It's kind of the $100,000 question, isn't it?
Yeah, it's because people want to make money.
Yeah.
That's really the fundamental piece, is everybody along that food chain. That was a very interesting graph, that chart that was put up there. Mm-hmm. Everybody, every block on there wants to make a buck.
So why are we just now seeing the political pressure put on our legislators?
We're getting louder. Okay, so the political pressure happens when everybody's voice just gets louder and louder. These high deductible health plans are getting more and more prevalent, so more and more people are exposed to list price, and that's really what's happening.
So now how about this new generic lower priced insulin? Will this affect other companies as well? I mean, we'll see a chain command.
It very much could. Lilly had to go out and actually get this FDA approved, even though it's the same drug, but they had to go back through. What they've really done is broken their contract, in my opinion. I don't see those contracts, but I think they've broken their contract with Express Scripts from the standpoint of, I now have a new drug that is not necessarily under that old contract, so that rebate that we had agreed to doesn't exist on this one, so I can lower the list price and set it where I want it to be.
And how do you promote transparency among insulin providers?
That is a very difficult thing, because they won't all get together and share it with you. So that is, transparency in the entire system as to what is net, what is list. It is just really coming out because there's a lot of pressure on that right now.
All right, well, thank you very much for being here today and shedding some more light on the situation. Appreciate it.
Thank you.